What's up everybody, welcome back to Earn It, Save It, Invest It. This video, I'm going to be breaking down HIMS' secret weapon. Now it's not an actual weapon or a product or a service, it's a person. It's their Chief Policy Officer, Deb Autor, right? Deb Autor. So I'm going to go over exactly who she is and why she is such an important factor to HIMS' success, and especially with this lawsuit that they're doing with Novo. So if you can, go ahead and please give a like and subscribe. I really appreciate it. And let's get into who Deb Autor is. So if you didn't know, really quick, HIMS is at 1630. It is down now 72%. It's a down on percent on the after hours. It is a Sunday. And if you look at their seasonality, it is just crazy. Down 16. January, February is going to be something crazy. They're going through this whole thing with Novo, right? With the compounded drugs, the lawsuit, all this stuff. So people are wondering exactly, who is Deb Autor, right? And why is she so important? This is her, obviously. We're HIMS and hers dealing with the FDA. And she actually was with the FDA, very important factor. So I'm going to explain who she is. So if you go on HIMS Investor Relations page and you go into their board of directors, you're going to see Andrew Dudum, the CEO, and then right under him, Deb Autor, right? So she's obviously very important right under the CEO. And this is what they came out with when they announced that she was going to be the Chief Policy Officer. Deb Autor is the company's first Chief Policy Officer. She will lead the company's global... Let me, if I can zoom in. She will lead the company's global public policy, regulatory, and government affair functions. A former senior leader at the FDA, prosecutor for DOJ, and leader in the pharma industry and nonprofit sector, Deb Autor is a trusted visionary voice in health policy. She brings more than 3 decades of experience to HIMS and hers, to help HIMS and hers ensure that innovation and integrity move hand in hand. I guess I'll read this. Autor previously served as Deputy Commissioner for Global Regulatory Operations and Policy at the FDA, where she directed worldwide inspections, enforcement, and international engagement efforts. She led enforcement and policy making for drug requirements at the FDA's Office of Compliance for the Center for Drug Evaluation and Research, and represented the FDA as a trial attorney for the U.S. Department of Justice. Now, that was a lot. Oh, let me take that away. That was a lot, right? But you can tell she's important, right? All of that, so she's been a huge part of the FDA, right? Right here it says a former senior leader at the FDA. She brings more than 3 decades of experience. So she is very important and experienced. Here's another, after she got hired as the CEO of Healthcare Innovation Catalyst, they put this out. With over 30 years of experience at the highest levels of government and regulated industry, Ms. Autor brings an unparalleled range of expertise across regulatory quality, compliance, business strategy, policy, and law. Her government career spanned 2 decades, culminating in a crucial role of Deputy Commissioner of FDA, where she oversaw all inspections and international operations. Her FDA tenure also included distinguished service as Director of the Office Compliance and FDA's Center for Drug Evaluation Research, where she led enforcement and policy making for compliance with all requirements relating to pharmaceuticals. Before FDA, Ms. Autor was a decorated federal prosecutor at the U.S. Department of Justice, and FDA was her client. I'm sorry, but if you're going to have someone going up against a big pharmaceutical company that's trying to sit, going up against the FDA, or at least knows what's going on in the FDA, what's legal in the FDA, and what's in the boundaries and the limit, this is a person who's probably going to know, right? I mean, this is someone who is going to know. And she's our number 2. I say our because I'm a shareholder, right? She's HIMS and hers number 2. She's the number 1 when it comes to the policies. Like CEO Andrew Dudum is just like, he makes announcements and he does business decisions and stuff like that, marketing, I'm sure, and stuff. But like, when it comes to the policy, she's number one. She's going to be like passing things through. So I don't think HIMS and hers is going to be doing anything on a consistent basis that is illegal or with that, outside the legal boundaries, right? Like there's of course the loopholes and then this and that, there's the exemptions and all, right? If you have a prescription for the 503A, like there's all these different things, and I'm sure she knows all of it. So from 1995 to 2001, she was a trial attorney in the Office of Consumer Litigation, the U.S. Department of Justice. First chair of dozens of civil and criminal cases under the Federal Food, Drug, and Cosmetic Act and other consumer protection statutes. That is literally the exact that's what we're doing, right? The Federal Food, Drug, and Cosmetic Act, that is what we're doing, right? So she knows her stuff. Conducted all court hearings, grand jury investigations, civil discovery motions, and settlement negotiations. Directed DOJ's handling of over 200 civil seizures nationwide of adulterated and misbranded food, drugs, and medical services. Set key precedent by winning the novel remedies of restitution and disgorgement for FDA violations. Prosecuted massive network of pharmaceutical diverters, protected the government's policy relating to anthrax vaccination of military personnel, and defended FDA's authority to regulate cigarettes from the district court through all appeals to the Supreme Court. So she, again, knows her business in law. She's not just someone who knows some science. No, she is a law person. She knows how the policy works, how it's supposed to be, what's illegal, what's not illegal. I mean, I would trust her. I don't, she's kind of new, obviously, but I would have to assume she walked in knowing, having a look at it and coming in. You are not going to announce that weight loss pill without her giving the okay. And who knows if it really was an actual launch of a product or if HIMS and hers knew. I mean, who knows? I mean, it's very possible that it was a bait, right? HIMS and hers said, hey, we're going to do this, and we know you're going to try to sue us and come after us. We're going to get all of this hashed out right now, right? We're going to, within this next 6 months to a year, we're going to settle. We're going to show you we can do our compounding semaglutide for the next 6 years until the patent is up, right? We can do it under the prescription basis. I just think that that's what's going to happen. Okay, fine, we'll give you some millions of dollars for our advertisement saying same active ingredient as Wegovy. Okay, we'll give you some millions of dollars for selling for a few months or whatever it was after the short, whatever it is. But I don't think the big one is going to be put up against HIMS and hers. And I think she would know it, right? I would have a feeling that she is someone who would know that. And then also Director and Associate, Office of Compliance and Center for Drug Evaluation and Research. So this is for, what was this? So this is for, this is for the FDA. So now we're on to the FDA in 2001. So she was the Director and Associate Director, Office of Compliance, Center for Drug Evaluation and Research. Led enforcement and policy making for compliance with all drug requirements, including drug approval, current good manufacturing practices, human subject protection, and biosearch monitoring, import and export, and recalls. Executed a groundbreaking initiative to eradicate marketed unapproved drugs, removing approximately 1,000 illegal drugs from the market. Developed and implemented solutions in highly visible and controversial areas such as counterterrorism, internet sales of pharmaceuticals, and heparin contamination. Expert advisor to all levels of FDA and federal government on complex legal issues, potential regulatory actions, and compliance policies and case development. Provided executive leadership and technical direction to a staff of more than 300 doctors, lawyers, scientists, pharmacists, and engineers. I mean, I'm going to keep going. I'm going to keep going and explain who she is, but I don't even know if I have to, but I will. For 2 more years, she was the Deputy Commissioner, Global Regulatory Operations and Policy. She oversaw all FDA inspections, criminal investigations, and international operations for human and veterinary drugs, biologics, medical devices, tobacco, and food. Led a multidisciplinary staff of over 4,500 and administered $1 billion annual budget. Developed FDA's pathway to global product safety and quality strategy for confronting globalization and import safety. Negotiated with Congress and industry to obtain stronger drug supply chain authorities, codified in the FDA Safety and Innovation Act 2012. Testified in congressional hearings and conducted international negotiations, diplomatic missions, and briefings for the White House, Congress, Office of Secretary of Health and Human Services, the Centers of Disease Control and Prevention, and U.S. Departments of Defense and State. Represented the administration in national and international print and television media, including New York Times, all this good stuff, right? I don't know. She seems like someone who knows her stuff, right? You have to remember, this is the person who is going to be saying, yes, this is legal. No, this is not. I mean, it sounds like she knows what's legal. And yet people are freaking out like, oh, HIMS is going to go, oh, they have to give up. They're done. They're toast. If you told me that this person is it has to go through her first to see if it's good to go or not, I'm trusting this person. It just sounds like she knows what she... Now, of course, people can make mistakes. She could leave in a few years if she's finding the malpractice. But she's not... I just don't... Why would she... I don't know. Unless HIMS is doing absolutely something illegal behind her back, but then why would they be hiring someone who is so credentialed, so credited? Like, I don't know, right? She seems absolutely amazing. She's also won some awards. This was the Federal Player of the Week. This was for the FDA. So it says FDA official leads charge against dangerous unapproved prescription drugs. This was in 2010. As director of the FDA's Drug Compliance Office, Autor designed the program to identify the unapproved drugs, evaluated the public health consequences, explored legal challenges, set up incentive, education, and outreach programs, and initiated an aggressive enforcement effort. So she even won some awards for the work that she does. She also had a Presidential Honors Award, tackling a serious and long-standing public health problem. Deborah, the FDA, has led an ongoing multi-year initiative to remove hundreds of... Wait, isn't this what I just said? Yep, never approved. Basically, it's the same thing, right? As director of Office and Compliance, Autor designed the program to identify the unapproved drugs, right? Same thing. She's winning presidential awards, presidential honors, right? If we look at... Now, this is her LinkedIn. She has 50 plus recognition awards from HHS, FDA, SDAR, and DOJ. Right? So you can go down all this. I mean, you can look it up. I will put her LinkedIn into the description. I'll also put a few other things in there that you can look up. Like the HIMS and Hers investor relations that leads directly to them. All that kind of stuff. I'll put that all in there so you can kind of look at it. But I mean, like, look at this. You know, it doesn't mean that, okay, HIMS is guaranteed anything. It doesn't mean any of that. But I'm just saying that if this person is on your side, wouldn't you have confidence that your side is not doing anything wrong? Like, right? Like, you might have done a few things wrong. Like, when it comes to the marketing of Andrew Dunham putting the same active ingredient as Wegovy, I think that's going to bite them in the butt. That's going to get something. But that's not something that she deals with in terms of, like, she's policy. Legal in terms of the actual drugs that are being made and how the drug that's being made, is it made in a legal way? Is it being distributed in a legal way? Is it being sold, bought? All these things is everything legal, right? In terms of the product. When it comes to the marketing, she's not really involved into that, right? So I definitely think, and we have to remember that she came in after the shortage had already stopped, and HIMS had already kind of continued to sell it, and then they stopped selling the generic version. So she came in after all that. So it's not like all the things that HIMS was doing in terms of product, even Deb was not a part of it at that time. Maybe HIMS said, hey, look, we're gonna really start getting into this Novo issue, and we want to hire someone who really knows their stuff, that's going to get us through and navigate us through this tough times. Because I do believe until the patent becomes public in 2031, it says December of 2031, until then, HIMS has to compound it through prescriptions. There's no other way, unless they have a deal with Novo, right? But they don't. So what they have to do is compound it, which I do believe that is their main goal. Their main focus is personalization healthcare. And if that's the goal, then you can personalize the GLP-1s and sell it. That's a legal thing. You know, you can't just say, oh, hey, we're expecting a bunch of people to have this type of, you know, personalization on GLP-1, so we're going to make a big batch of it and then sell it to the people who then come in and say that, no, you need to have a prescription. The person comes in, and then you make it accordingly, you know, as the orders come in. And HIMS is also way bigger than just the weight loss, right? They do all kinds of other things. They have the compounding facilities so they can do other drugs. So it's not just the GLP-1s, but obviously that's the main focus right now. That's where they make the most money. That's what's in the market, you know, in the media, and that's what the lawsuit is about. So again, just looking at it, I do believe Deb Autor is going to be a significant value. She's going to be a great asset for HIMS and hers, and I do think she's going to be able to navigate them through the lawsuit to minimize any damage. Like I said, I do believe the advertisement, the marketing, it says you cannot put out there that you have the same ingredient, active ingredient, as other, you know, medicines or, you know, whatever, and other ingredients and stuff like that. You cannot say that of another company if it's not, and it wasn't, right? They don't have the same exact active ingredient as Wegovy, and that's what they were putting. And then they couldn't, you're not allowed to sell it after the shortage was lifted, right? They said, okay, it's not more, there's no more shortage, so therefore everyone has to stop, right? Only Novo and whoever they've dealt with and they've made deals with can sell it. So yeah, anyway, that's my 2 cents. I do believe HIMS is going to get through this with pretty much a slap on the wrist. But just because HIMS gets by on a slap on the wrist does not mean the stock gets by with a slap. Clearly, it's gone down 72% in the last year, right? I started my $100,000 challenge and HIMS was at 50. It has destroyed me in this whole challenge, but I believe in the company. I believe it will go up over time, and that's at the end what my goal is to buy good companies that I believe are going to grow over time. And so it is what it is. So yeah, thank you for watching. I really appreciate anybody who's still sticking around. Please go ahead and give a like and subscribe. This is a shorter video than usual, actually. I like it. But yeah, I think HIMS and hers is going to get through this lawsuit with Deb Autor as their secret weapon. Maybe it's not a secret anymore because I'm telling you. So yeah, thank you for watching. Please give the like and subscribe, and never forget to earn it, save it, invest it, buy low, sell high. I want assets, not liabilities, and you can count on compounded interest.